Welcome to the Part D Extra Help edition of Medicare in Minutes, a microlearning series designed to help you understand the ins and outs of Medicare. There are many programs available to those who might need some extra assistance paying for Medicare, but there is only one that works specifically for Part D benefits. The Part D Low Income Subsidy Program, or more commonly known as Extra Help, pairs nicely with most other Medicare savings programs to create a comprehensive support system. These other programs are covered in our cost savings program video. Check it out for more information in regards to cost savings for other parts of Medicare. But for now, let's get into the specifics of Extra Help. This program, with over 14 million enrollees and counting, could be enrolled in automatically if beneficiaries are eligible for other programs such as Medicaid, Supplemental Security Income, QMB, SLMB, or QI. Beneficiaries might also qualify based on their income and resources. A few other requirements, such as being enrolled in Parts A and B and residing within the U.S., must be met too. Beneficiaries do not need to be enrolled in Part B when they apply, but will have to choose a Part D plan soon after they are accepted. If they do not, a plan will be chosen for them. To determine eligibility based on resources, beneficiaries may not exceed the resource limits of $9,090 or $13,630 if married for the full low-income subsidy and $15,160 or $30,240 if married for the partial low-income subsidies. But how are resource limits determined? In order to calculate this figure, the following resources are counted alongside traditional income revenues: real estate, excluding primary residence, checking, savings, and certificates of deposit, stocks, bonds, including U.S. savings bonds, mutual funds, individual retirement accounts or IRAs, and cash. However, there are also resources that are specifically left off this list, such as primary residences and vehicles, personal possessions, and burial plots. This list differs from MSP and is available in its entirety on the Social Security website. If these resources combined together with income are over the threshold, beneficiaries will not be eligible. But as discussed in other videos, each state is different, so it might be advantageous for beneficiaries to apply even if they are unsure if they qualify. Those who are not automatically enrolled in Extra Help can gather an application at their local Social Security office. It should be understood that coverage is divided into full and partial tiers depending on the level of resources beneficiaries have, so each support will have two different levels within to keep in mind. A premium generally is paid by beneficiaries if they have a total income between 135 and 150% of the federal poverty line. Otherwise, there is not one. Those with full benefits will not have a deductible, while those with partial help will have a $99 deductible. Once enrolled, beneficiaries will enjoy caps on the cost for each prescription drug they need, which again are more precisely determined by resource level. Full help limits the drugs to $4.15 for generic and $10.35 for brand name, while partial help leaves beneficiaries responsible for a flat 15% of the drug's cost. Both full and partial help come with a $7,400 out-of-pocket max. Once that is reached, beneficiaries will not have to pay anything for their covered medications. Another benefit of Extra Help is the waiver for any potential Part D late enrollment penalties. Beneficiaries who had credible drug coverage available but did not take it can be subject to late enrollment penalties, but qualifying for Extra Help waives those. Qualifying for this program allows beneficiaries to enjoy an extra special enrollment period per quarter, allowing them to join, switch, or drop their Part D coverage one time to take advantage of their subsidy as they choose. As long as beneficiaries still meet the requirements, they should be able to maintain their enrollment each year. Beneficiaries should also keep on the lookout for a letter around the end of October to any changes that might be made to their payments or program coverage. While Extra Help is not the only Medicare assistance program available to beneficiaries, it is the only one specifically supporting Part D and is most widely used cost savings program. It is important to strike a balance between comprehensive and affordable coverage. and cost savings programs are a tool beneficiaries can use to help in that process. Check out our cost savings programs video for more information on the rest of the support programs available. While shopping for Medicare can be a nerve-wracking experience, you can take steps to prevent some stress associated with affordability when working with a knowledgeable agent. Questions regarding this and all other Medicare topics can be directed to your agent. Thank you for watching.